Chai Chat with Lavina. NHS is under pressure, and a recent study by the Lib Dems has told us that people are having to do DIY kind of treatments, appointments nahi mil rahi hai, and it is really in distress. We can see the strikes going on all over the place, and patients, people like us, are suffering. But even more severe, I'm told, recent survey telling us that the people who are not getting appointments, amongst them, Asians are in higher number. Now, why is that, and what can be done about it? I'm joined here by two stalwarts of their field. On my right is Dr. Parag Sighal, who's an endocrinologist, I managed to say that, and also from VAPU Training Academy, exchanging doctors, which is quite important because NHS is depending on a lot of overseas staff. And here on my left is Dr. Chaand Nagpaul, Chairman of British Medical Association Forum for Ethnic Minority Equality.
Yeah.
Almost there.
Yes,
Almost
that's
there.
right. Yes, that's right.
Thank you, and that's where it's really hinged. But thank you very much. And we're going to talk a lot about the Desis, and so we are in Desi hype, having a lot of Desi food.
Absolutely.
which is the plus point of being on a Chai Chat. Thank you very much for your time. So I think I'm going to go to you first, Dr. Nagpaul, but you're free to. What is this research? Why are the Asians getting appointment later on? And tell me more.
Okay, so the UK's National Health Service at the moment is under huge stress and pressure, more than we've ever known since it was formed in 1948. And there are now currently about 7 million patients waiting for treatment, for operations, and a backlog because since COVID, there were large numbers of operations cancelled as the country was trying to cope with COVID. So there's a huge backlog. On top of that, within the community, I'm a GP, so within the UK, patients go and see their GP first before they can go to a hospital. We have got a reduction in number of GPs, and the demand for care has escalated. So we don't have enough doctors in the community to care for the demands of the population. In hospitals, similarly, there are not enough hospital beds and not enough ambulance crews. So patients are now queuing up to even get into hospital. And when they get into the accident emergency, they have difficulties getting admitted to hospital. And then we don't have enough community beds. So when patients need to be discharged from hospital, many need rehabilitation. There isn't enough facilities for the community. So the whole system is under huge pressure. What research has shown is that people from ethnic minorities, and Asians in particular, had a greater number of operations cancelled, or delayed rather, during the pandemic. And so they are forming a greater part of the backlog. And I think that, speaking as a family doctor, when there is a huge pressure in the system, what you find is people who understand the system best, who know how to navigate it, who know how to complain, probably end up getting a quicker service. And for a large number of our Asian population, English may not be the first language. They are less likely to be pushing for change. A lot of the consultations now are done by telephone and remote, so often there's communication barriers. So I think what we need is to really increase awareness that when we're trying to cope with this huge pressure and backlog, that our Asian patients, our Indian patients, are given the right information, they're given the right advocacy, they're given the right ability to make sure that they can be put on the right queue and be treated in the same way as other members of the population.
So when you say Asian, who all will come in this?
Well, by Asian, what I'm referring to, what the research has shown, would encompass people from the sub-Indian continent. So that would be from India, Pakistan, Sri Lanka, and Bangladesh, of course. By Asian, we're really referring to South Asian population. That's India, Pakistan, Bangladesh, Sri Lanka, that subcontinent area.
Yeah.
And where we are today in this restaurant eating, we have a very high proportion of of an Indian population. In fact, I would say probably 50% of the patients at my practice are of Asian origin, largely Indian, but also Pakistani, Bangladesh, from Afghanistan, increased numbers from Afghanistan as well. And these are patients for whom, understanding how the system works, how to chase up the fact that they haven't had a hospital appointment doesn't come naturally. And so I think we do need to put in place systems that can provide greater support and advocacy, because what they often get is a phone call from a hospital, and they don't even understand what the conversation is, and they're just not prioritized.
So one is the lack of communication because of language barrier, but the entire NHS actually has been suffering and is going through a lack of workforce. And how long, because we have had this conversation before, Dr. Singhal, how long has this been going on, and when were the signals already coming? कब से शुरू हो गया था हाथ उठानी ये समस्या?
So the pressures on the NHS have been going on for years. Maybe you can argue for 10, 12 years. And funding has always been an issue. But certainly the COVID has exacerbated the challenges. So it has challenged the system further, which was already challenged. So now, as Chaand says, we are experiencing pressures not only in the hospital, but also in primary care. And I think primary care is a bedrock of any health system. So unless we pay attention and strengthen primary care, we are going to destabilize the whole system. So, and we know that NHS has, for many, many years, has been reliant on international medical workforce. And it's not new. And now more and more international doctors are arriving in this country. So we have got a crisis, which is backlog of 7 million patients, not lack of availability of hospital beds. So hospital beds is a separate issue. But certainly to get rid of the backlog, we need proper workforce. We not only need more numbers, we need doctors, nurses, physiotherapists, echocardiographers, everybody, but we also need proper training and proper structure. Because what has happened as a result of COVID is that the training has suffered, more so for international medical graduates. And what we don't want to do is to bring international medical graduates to an environment where they don't get proper training. I think we need to come up with a culture where international medical graduates bring something different. And we need to have a system of shared learning, so that British system offers something, and anywhere that doctors are coming from, as Chaand says, Indian subcontinent, Africa, or wherever, they also bring some added value to the system. So what we are trying to do is to create a system whereby these international doctors get training in their home country before they come to the UK. And the reason for that is, when they come to a new system, it's a big challenge for them to adjust to a new system. They're completely new, whether it is about induction, how the NHS works, how the country works, how the patients work. Everything is absolutely new. If somehow we can create a system where all this thing is done in India, training on the lines of NHS is given in the home country, so they are well prepared for their arrival in UK, and they hit the ground running when they come to UK. That is exactly what we are trying to do, and create a structure for them so they get appropriate training when they come to this country.
So what is this going forward solution? Being in the service, being a former medical chair of British Medical Association as well, where do you see the solution? Jo Rishi ko hum thoda sa gyan de dein.
So one thing is that we know that the biggest limiting factor in our national health service at the moment is workforce, meaning the number of doctors. And the UK has we've done calculations, about 43,000 fewer doctors adjusted compared to the average EU country, European country. And the other striking statistic is that more than 50% of doctors who enter the UK medical register in any 1 year come from abroad. So in fact, there are more doctors from abroad entering the medical register in the UK than doctors who qualify in the UK. And the largest proportion of that overseas workforce that come to work here come from the Indian subcontinent, and in particular from India. So one thing that we do need to do is to make it easier and remove obstacles to those doctors who want to come and work here. Now remember, it's not that all doctors who come, let's say from India, want to come and stay here, but they want to come and do training. We have excellent postgraduate training in the UK. They want to, as a result of that experience and specialism, they want to take those skills back. But whilst they're in the UK, they're providing a valuable service. So one message to Rishi Sunak, I would say, is that he should be making it much easier for doctors from other countries to come and have specialist training here. And Parag can talk about some of the initiatives that he's been involved in. And by doing that, not only are you skilling up doctors and giving them the benefit of the UK's medical expertise, they can take that skill back, but whilst they're here, they're also serving the UK population. So I think that's something that really would help.
Good point. At the moment, he said challenges and barriers. What are the challenges and barriers that the doctors coming from India or Indian subcontinent face, which need to be addressed?
So there is multiple challenges. As I said, the environment is new, the system is new, and it takes time for them to adjust to the system. And during that time, whilst they're adjusting to the system, it is very likely or they're prone to making a mistake. So they need a lot of support during that time.
Just to ask you, when a doctor gets trained in India and is coming here, does he need to get trained more here to get to work in the NHS?
It's a different system. It's about training in a different system. So being trained in India is different because there is a hierarchy, communication, governance, patient safety. Those things don't exist in India as much as they do in the NHS. So they have to get used to the NHS structure.
So are they getting used, or are they also giving exams to?
So they are doing both. So they are learning as well as they are getting used. So it's a further check.
Okay.
And then international medical graduates, a lot of them have families. So coming with the family, settling down, changing the job is always a challenge. So there are multiple challenges they face.
No. So I want to break this down and understand for a doctor. If he's coming from India, they apply to the NHS?
Yeah. So,
and then do they have, when they come here, do they have to face an exam, or they straight away start as well?
No. So what any international medical graduate has to either do PLAB exam, which is an entrance exam to be eligible to be working in the UK. Licensure exam run by GMC. So that is one route. There is another route which is for postgraduate doctors. Postgraduate doctors can come on medical training initiative route through Royal Colleges. And the third route, which we have developed at the Training Academy, is a fast track route in which we sponsor these candidates for GMC registration, and that is how we are bringing all the postgraduate doctors through this route. Now, our another program which actually offers PLAB exemption is at a junior level, where these doctors are receiving training in India for 2 years on the NHS pattern, supported by UK faculty. So before they come to UK, they are fully prepared for NHS arrival. They don't have to take any exam, and they simply start in the NHS job.
Okay.
So that's the beauty of the program.
Okay, and that's what you mentioned that. So I'm going to take a break here, and after the break, I want to come back first to you, Dr. Nagpaul, and ask the idea that you came up with, which our Prime Minister could possibly use. He's under great pressure from both the parties to how best can we use our doctors. So stay tuned, and we'll be back shortly.